Chapter 23 is over the complications of adolescence. So one of the major issues in adolescence right now is obesity. This is determined by calculating the body mass index, or BMI. It's a standard calculation based on age, height, and weight. BMI in the 95th percentile or greater is considered obese, and between the 85th and 95th percentiles is considered at risk for obesity. Adult BMI charts are different than adolescent BMI charts. If you've ever looked into like BMI before, it is a little bit different for adolescents because it does take age into effect. Adolescent obesity is becoming more and more prevalent in the United States. This shows the prevalence of obesity in our adolescents. There's been an increase in obesity between 1980 and 2012. The 6 to 11 year age group has increased by about 11%. And the 12 to 19-year-old age group has increased by about 16%. So the reason that this is significant, and I know we don't have any measurements, beyond 2012, but just know it's not getting better. The reason this is so significant is that because it leads to an increased risk for type 2 diabetes in kids and adolescents, elevated cholesterol and lipid levels, increased blood pressure, as well as psychological problems. So we talked about some musculoskeletal issues previously earlier this semester, but some of the different curvatures of the spine. So kyphosis, this is your hunchback. There's an increase in the convexity of the thoracic spine. There's unequal growth of the spinal muscles. This can happen in older or in adults that's secondary to disorders like osteoporosis and tuberculosis, or like I said, we do see this in our adolescents. Lordosis, this is the sway back. This is an exaggerated lower back curve. It usually develops because of poor posture during the adolescent growth period, and obesity can make this worse. So here's some pictures here. This is your normal spine on the left. The middle is that kyphosis, that hunchback, and then that right-sided one is the lordosis, that sway back. And then we have scoliosis. This is a lateral curvature of the spine, like a C curve or an S curve. It affects the thoracic or lumbar area, or both. It can compress the heart, the lungs, or both. Structural is a primary spinal deformity because of an unequal growth of the muscles, and functional or non-structural scoliosis is secondary from another problem, like a back injury or a spasm. And here's the picture of scoliosis. So the left is a normal spine. The middle is a mild scoliosis. You can kind of see it's like an S-shaped curve. And then the right-sided one is a severe scoliosis. And then on the far right, you can see when they're when they're bent over, that there's like a rib hump because the vertebrae rotate as they bend over. Other issues, we have juvenile rheumatoid arthritis. This is a group of autoimmune diseases that's caused by inflammation in the connective tissue, like in the joints. We don't specifically know why this happens, but we diagnose it with joint swelling or discomfort that lasts more than 6 weeks, and other general signs of inflammation. To treat it, we use NSAIDs, glucocorticoids if it's severe, and different DMARD drugs. Eating disorders are also another common issue for adolescents and young adults, especially in our Western cultures. Primarily the females, but males can be affected as well. Actually, the rate of being affected as far as males go is rising. It is a major medical concern. There's an effect of poor nutrition on the growth and development of the person, as well as all throughout their systems, deterioration, etc. The two major problems are anorexia nervosa and bulimia nervosa. So in the previous chapters, we've talked about anorexia just being that general loss of appetite. Anorexia nervosa is the eating disorder. So anorexia nervosa is extreme weight loss from self-starvation. This is not the loss of appetite, like I mentioned. It peaks in the early teens and then again later in the teenage years. It results in severe malnutrition and protein and vitamin deficits. An anorexic person looks emaciated or emaciated, which is very thin and kind of wasting away. Girls that have anorexia nervosa usually don't have a period. This is called amenorrhea. Signs and symptoms are low body temperature, intolerance to cold, low blood pressure and a slow heart rate, dry skin, brittle nails, development of fine body hair. I know we have body, hair that covers our whole body, but this is a different kind of like fuzzy hair. Low calcium intake, which is a predisposition to osteoporosis later in life, and dehydration that affects kidney and cardiovascular function. Electrolyte imbalances can cause cardiac arrhythmias and cardiac arrest even. Anorexia can be life-threatening. So for treatment, we do hospitalization and long-term psychotherapy because this is considered more of a psychiatric problem to deal with. Then bulimia nervosa happens more often in older adolescents. It's characterized by binge eating and then purging, which is self-induced vomiting or diarrhea, like in excessive laxatives. The purging can also be, like I said, from excessive laxatives, but also diuretics. These patients usually compulsively exercise. I took care of some of these kids when I worked at Phoenix Children's Hospital, and you'd see them doing like ab crunches and leg lifts in bed. They even like hovered over the toilet. Like any amount of exercise that they could get, they did. They weren't allowed to exercise, so their movements were so minimal, but they still tried to exercise all the time. Bulimia and anorexia often overlap. Unlike an anorexic person, though, a bulimic person usually maintains a normal weight, but they don't have appropriate nutrition. So that's where it becomes a problem. So they can have problems like anemia, menstrual irregularities, fluid and electrolyte imbalances because of the frequent vomiting. This can cause cardiac arrhythmias, tetany, and severe abdominal pain. They will have erosion of the tooth enamel. They might have tears and ulcers in the oral mucosa and esophagitis with sore throat and difficulty swallowing because, again, everything that is all the acid and stuff like that in the stomach is meant to stay there and go lower. It's not meant to come up. So if it's coming up, then it's kind of tearing away at all of those tissues. And then on to skin disorders, specifically acne vulgaris. This is a common skin infection in adolescents. It involves the sebaceous glands and associated hair follicles on the face, neck, and upper trunk. There's a wide variation from mild to severe. It just depends on the person. If it's severe, though, it can lead to permanent scarring. So here's some pictures of severe acne. And then we have infection, specifically mononucleosis. So mono is nicknamed the kissing disease. It's caused by the Epstein-Barr virus. It affects the lymphocytes. It's common in adolescents and young adults. It is nicknamed the kissing disease, but you can get it from any direct contact with infected saliva, airborne droplets, or blood. So we see this a lot, like I said, in adolescents and young adults, not just from kissing, but like from sharing a soda or whatever. And it is, like I said, it is common. It's usually mild and self-limiting, but complications can happen. Self-limiting just means it goes away on its own. There's an incubation period from about 4 to 6 weeks. So for 4 to 6 weeks, somebody might be carrying it and not know that they have it to transmit. Signs and symptoms are sore throat, headache, fever, fatigue, malaise, enlarged lymph nodes, and enlarged spleen, a rash on the trunk, increased in lymphocytes and monocytes in the blood, and atypical T lymphocytes, and they will be positive. They will have a positive heterophil antibody test. So that would be, how we would diagnose it. And for treatments, we would just, again, treat the signs and symptoms because it usually will go away on its own. And that's all that I have for Chapter 23, Adolescence.